Welcome to Leveraging the Laboratory, a Mayo Clinic Laboratories podcast for administrators, outreach managers, and laboratory professionals to learn how to best leverage and optimize the laboratory for patients, clients, and staff. I'm your host, Jane Hermansen, Outreach Manager at Mayo Clinic Laboratories. And joining me today is Dr. Vipul Trivedi. Dr. Trivedi is the Chair of Pathology for the Mayo Clinic Health System. And our topic today is about the vital role that the pathologist plays in supporting the community-based laboratory outreach program. Dr. Trivedi has responsibility for literally dozens of hospital laboratories across the Mayo Clinic Health System and has truly a unique view to bring to our podcast audience today. So, Dr. Trivedi, without any further ado, tell me a little bit about yourself and your role at Mayo Clinic.
Well, thanks, Jane. Thanks for having me here today. I am, in addition to the chair of the Mayo Clinic Health System, Department of Laboratory Medicine and Pathology, I also sit on as a division chair in Rochester for the Division of Community Laboratory Medicine and Pathology. In that role, I help oversee some 38 hospitals and clinic laboratories. So the goal is to help coordinate testing, standardized testing, and to have it work in conjunction with testing that's performed at Mayo Clinic Rochester.
That's not an easy job to coordinate 38 different laboratories. So that's huge work. So thank you for what you do. And so what we're going to talk about today in this podcast, we typically talk about the operational and the business aspects of the laboratory outreach program. And we haven't really discussed the role of the medical leader for the laboratory, and in particular, the pathologist's role in supporting the outreach program and the in-reach program. So the testing that's performed truly for patients and providers outside the hospital. So what do you see, Dr. Trivedi, as the role of the community-based pathologist in supporting a laboratory outreach program?
Yeah, so, as you kind of mentioned, pathologists act as medical directors for the laboratories, both in the community setting and in a larger academic institution. The difference in the community setting is we often have multiple laboratories that we're medical directors for. In that manner, we're often involved in both contractual relationships with those laboratories, and we also ensure that appropriate tests are performed both in-house and also have a consultative manner with who we're going to send those out to as our reference laboratories. So sometimes as laboratorians, we get focused on mostly the testing aspects, and we don't necessarily think of how we're going to be affecting our reference laboratories and what all the pre-analytic steps that we may have to take. So one of the things that we definitely help to do is ensure that these tests are collected appropriately in coordinates with what the reference lab would like, and that they're sent out appropriately, whether they need to be frozen or spun before they get there or whatever that is. We make sure that that happens.
So just really providing that nice oversight for the laboratory. And I'm sure you've seen through holding probably different CLIA licenses, a number of them for different laboratories. When you've seen one lab, you've seen one lab, right? So how do you coordinate within a health system to make sure that those labs are all working in step?
So what I've done is to help myself, I like to help myself, basically. So what I've done is set up a system that works with the laboratory technologists, and we have what we call work groups. And see, these work groups help us to standardize procedures, standardize the testing, standardizing the implementation. And we have pathologists that are involved in these work groups. That helps us come to these multiple laboratories with a uniform way of working with them.
So work groups, and you're really collaborating with the scientists, but providing at least that medical oversight. So I think my next question for you, being the medical representative, what I see is the pathologist being the doctor's doctor, right? And when you are the face of the laboratory and the community to those medical providers, clearly you become a lightning rod for a lot of questions. Just what kind of questions do you receive from local providers on a daily basis? I'm assuming you're out there talking to providers, not just the laboratories that you direct. Tell me more about your relationship with the local providers.
Yeah, so it's very interesting. As a APCP pathologist, we get questions on a daily basis that span the gamut of both anatomic and clinical pathology. So examples of questions that I maybe get from 1 second to the next. The doctor comes into the office, says, I'm going to be doing a biopsy. How should I submit that biopsy? Should we do a frozen section on it? If I have to do ancillary testing, what should I collect to make sure that that gets performed? Then move to the clinical lab the next second. Our turnaround time is a little too long on our intraoperative PTHs. What can we do to make that go faster? How are we going to get those results to me so as I'm not wasting my time in the operating room? I may need to start doing a process flow map. So now we're getting into process improvements and things like that. Other questions that come in commonly are, is my patient hemolyzing? So that's a common question. So we'll say, well, let's take a look at the peripheral smear. Did you do a LDH? Did you do a haptoglobin? So we kind of help assist in picking out what testing may be appropriate to help them answer their questions.
So multiple hats. So what I
Yep.
heard you first saying, here's how you collect an anatomic specimen for optimal stuff. Now you're troubleshooting turnaround time aspects. And then the next thing is a clinical advisement to say, I think my patient has this condition. What tests do I order to get there?
Yep.
And then do you ever find yourself in a position then of saying, you know what, you're not ordering the right test to get to this answer? Can you tell me a little more about your advisement of to change behavior for providers?
Yeah, so we do that all the time. One of the hardest things that we've ever had to do, and we've managed slightly, but the erythrocyte sedimentation rate, or ESR, is basically an antiquated test. Yet providers constantly feel like they need to order it, right? Um, we've tried to just kind of send out memos to talk about maybe a CRP is a better test. So after working closely with the appropriate parties that are the most interested in keeping the testing, which we felt would be rheumatology, maybe infectious disease, maybe somebody else. But the one I didn't think of was orthopedic surgery. I just didn't think that that was going to be a big deal. But we found all the interested parties. We talked to them. We decided, well, and this was all during a time when we were having to buy new analyzers for this test. And we had them at all of our 38 sites. And eventually I worked and worked and worked, and we got them narrowed down to only having them at 3 sites. So if you can imagine, that's utilization management right there. It's also helping to decrease the cost of care to the patient and help to avoid unnecessary testing that doesn't add any value. So
Right, driving to the right diagnosis. Back in my community hospital days, I used to work in a small hospital. I'd be on call around the clock, and I remember getting called at 2 o'clock in the morning to come in for a stat sed rate. Well, there's no such thing as a stat sed rate. My sleep was more important to me, but I did it because I didn't have a pathologist like you to back me up. So clearly, you're helping support the lab. So, my next question is really about strengthening relationships with local providers. Do you ever feel that you might actually almost be in a sales role with the laboratory to help highlight some of the strengths and capabilities of your laboratory? And if so, how do you handle that?
yeah, so that's a really good question. I am a big fan of an open door policy. So many pathologists like to have a tendency to just go in their office, close the door, stick their head in their microscope, and look at slides all day. Um, I kind of do it a little different. I have to look at slides occasionally, but I tend to actually go to the doctor's lounge, start talking, seeking out providers, ask them how the lab can help them. Is there any testing that you might need me to add? Is there any issues that I may be able to help you with? Um, Another thing is we try to send out yearly surveys to all the physicians to try to get that, basically answer those same questions for them. What tests can be brought in-house? We found that doing it yearly is really helpful, and it gives us a lot of feedback that we can then improve ourselves. And it
So
strengthens that relationship with local doctors.
absolutely. So I love the yearly survey, but I think the more important thing that you're doing is getting that daily feedback, those daily interactions, and they see you come and they go, this is the lab guide. So from your perspective, well, from my perspective, what I see is a pathologist who is not afraid to get out of the office and step away from the microscope. Not all of your peers are quite wired that way, but I would hope that you might be able to inspire some of them to actually do that. So when we think about just being the medical partner, and I know at Mayo Clinic, we use the dyad model for our leadership, medically led, professionally managed. So you have an administrative partner who manages a lot of the business aspects. But when it comes to really aligning the medical services of the laboratory, it's your discretion based on feedback. How do you see your role as guiding the future of the laboratory as far as choosing technology, aligning with clinical services, and just service overall? We've talked about some of the concerns and problems that come up over time, but how do you see yourself as a leader looking future-wise?
Yeah, so one of the most interesting things that I've read about, but haven't yet had the opportunity to implement at our site, is the pathologist rounding with the patient care team. We, as pathologists, we are trained as experts in laboratory testing. That's what we do for a living. We understand laboratory. So what we can do best is, but when we round with that team, we can add value by assisting the team in which tests to order, which actually at further, which tests not to order. Those are both very helpful things. This once again leads to helping with test utilization, decreasing the cost of care to the patient and the institution.
So actually rounding with the providers and even being at the patient bedside, correct?
Exactly, yeah.
Well, and I think that today what I've seen is that there are some new CPT codes that actually allow for almost a patient consultation for a pathologist to view materials and talk with patients. I visited a laboratory not too long ago that actually had a consultation room so their pathologist could come out and meet with a patient if needed. So it's changing, right?
It's definitely changing, and we do this on the anatomic side fairly often. It's not unusual to have a patient want to talk about their biopsy result and see their specimen and things like that. But we haven't done it so much on the clinical laboratory side, and so that's a kind of an exciting area that we may be starting to forage into.
Sure. And I think that what I've seen is that patients seem to be more engaged with laboratory today. They have access to the portals, they have access to their results. Some of them are leveraging direct access testing to order some of their own tests. So you may become a very valuable resource to help people understand. And I probably expect there's a balance between making sure that you're not overstepping into the local clinician's role of being the diagnostician, correct?
Oh, for sure, yes.
Yeah, yeah. You're talking to patients, you're talking to providers, you're leading the laboratory, you're getting ready to start doing some rounding. When we talk through all of these ideas, I have to remember that you're only one person, one guy. What advice do you have to any pathologist who might be listening and trying to figure out, oh my gosh, listen to what Dr. Trivedi is doing. That's a lot. How do I do it all? How can I manage all of these different perspectives of effective laboratory leadership from the pathologist perspective?
Yeah, the first thing I would say is don't feel that way. Um, You actually, or we as pathologists, have a great professional team behind us, dedicated medical laboratory scientists that really do care extensively about their patients and provide care for them. The question becomes more is how can I help facilitate that, what they are already doing well? Um, a good system is more important and invaluable to making my life that much easier. So what do we do? What have we done? We kind of touched on it earlier, where I work on standardized policies and procedures across multiple sites. What that helps me do is I'm not spending a lot of time reviewing procedures. I can review one procedure for multiple sites. That saves me time, right? So plus it makes better operating procedures for techs who may travel between sites. So I would say definitely leverage the expertise that you have within the laboratory. In addition, what I've found is the reference laboratories that you may use often have experts at those. Make friends with some of those people at those sites so as that you have a contact available that you could always call for any assistance that may need. Medicine is becoming very complex nowadays. I just heard a conference where somebody said that, sorry, since 1900, only 50% of, we doubled our knowledge 50%. In the next 20 years, we doubled it 100%. In the next 20 years, we had doubled it exponentially. So there's no way that you can know everything. I think the key to remember is you can't know everything. Help yourself by having contacts that you can leverage.
Sure. So you're really aligning with your laboratory teams, you're aligning with peers, and then also true industry experts when you actually need that help. I love that, because clearly you can't do it all, and you still have slides that you need to read and medical staff meetings that you have to attend. Plus, you've got to round and make it into the physician lounge for lunch. So clearly, lots of good stuff to do there. So I think what I like to do, Dr. Trivedi, I always close this podcast with kind of a favorite tip, kind of a hot question, kind of a turbo round. And since there's one person here, it's you. And it's really my way of summarizing the session. If you had any best practices, if you had some advice for community pathologists, especially when you look at providing services outside of the hospital to an outpatient market, do you have any best practices that you'd like to share with our audience today?
Yeah. So I've kind of touched on several of them, but I'll kind of summarize here a little bit. I encourage every pathologist to get out of their office, to get into the laboratory, to make daily rounds and talk to your staff. First of all, they'll appreciate it more than you can imagine that you're interacting with them. It'll also give you a better pulse of what's going on in your own laboratory. Any problems that may be starting to occur, you can curtail right away. In addition, it helps promote that positive culture within the laboratory by letting them know that you're available. And in that same breath, like I said, if you can get out of the office and get to talk to your clinical physician colleagues, that will also help you. Sometimes they notice things that we don't notice within the laboratory because we're so close to it, and they see it at a more higher level. Thirdly, standard operating procedures across multiple sites, and don't forget to concentrate on the pre-analytic phase so as that you can make sure that you get your specimen to your reference labs in a safe, timely manner.
Fantastic. And if I were to summarize all of those things, work smarter, not harder.
Yeah, exactly.
Okay. So Dr. Trivedi, I can't thank you enough. You are truly such a valuable asset within our own Mayo Clinic Health System, and your views on how a community hospital pathologist supports the laboratory and the outreach program are tremendously important to me. So thank you so much for taking the time to share that. And I hope others are as inspired by your experiences as I've been today. So thank you so very much.
Yeah, thank you for having me.
You bet. And thank you to our audience today for listening to Leveraging the Laboratory, a podcast from Mayo Clinic Laboratories. If you've enjoyed this podcast, please subscribe. And until next time, we encourage you to continue to promote your community-based hospital laboratory. The needs of the patient come first.